हे एवरीवन, वेलकम बैक टू द चैनल। हम लोग स्केलेटन जो टॉपिक है जनरल एनाटॉमी से उसको कंटिन्यू करेंगे आज, और वी विल स्टार्ट विथ क्लासिफिकेशन। सो लेट्स गेट स्टार्टेड। इन स्ट्रक्चरल क्लासिफिकेशन the bone is divided into compact and cancellous bone. Compact basically is the dense bone and cancellous is the spongy bone. Now compact bone we find it in the shaft जिसमें medullary cavity होता है बीच में, and cancellous bone ends में मिलता है, लेकिन उसको surround करता है एक thick layer of compact bone. ठीक है. Now fact है inferior nasal concha, that is in the nasal bone you will find when you read the maxilla bone. Inferior nasal concha, just remember the name. Inferior nasal concha consists of only spongy bone, right? Next is compact bone. Let's see. It is dense, ivory like, and no visible spaces, right? It consists of lamella of collagenous sheet and Haversian system or osteoid. See, ये अगर बोन है, ये सर्कल जितना भी दिख रहा है ये सब आपका ऑस्टियन कहते हैं इसको, और हैवर्शियन सिस्टम. ये सिस्टम क्यों कहते हैं इसको पता चलेगा अभी. नाउ दिस लेमेला, जो लेमेला है, दिस लेमेला इज ऑफ 3 टाइप्स, राइट? कॉन्सेंट्रिक लेमेला, इंटरस्टिशियल लेमेला और सर्कमफरेंशियल लेमेला. Concentric lamella surrounds the Haversian system or Haversian canal. This is the concentric lamella, right? See, concentric lamella, this is the concentric lamella. And interstitial lamella is between osteons. These are the remnants of the old Haversian system. So इस बीच में जितना भी ये सब दिख रहा है, these are the interstitial lamella. ठीक है. And then circumferential lamella. Circumferential lamella covers the whole bone, right? So what are these? These are the spaces where there are cells present. Now what is Haversian system or osteon? Haversian system is formed around the central canal or known as Haversian canal. It is surrounded by concentric lamella of the bone, as I said, and it runs at the long axis of the bone that contains blood vessels, nerves, loose connective tissues. ये सीधा सीधा ऐसे. These are the Haversian canals. ठीक है. Now what are Volkmann canals? Volkmann canals are the canals which are transverse and they connect the Haversian canals. What are these? Now let's see. These contain blood vessels, nerves and loose connective tissues. Okay. Now the concentric lamella are 4 to 20 in numbers, and these have osteocytes in them, right? Now what is lacuna? Lacuna is a communication, is a gap, it's a communication with each other and central canal and across lamella by numerous radiating canaliculi. See, these are the lamella with radiating canaliculi. See, these are the canaliculi. ठीक है. These canaliculi are spaces जहाँ पे communication होता है between two lamellas. Now, as I said, Volkmann canal runs perpendicular, communicates between medullary cavity and with surface and Haversian system. This system is known as canal system of the bone, right? Now, coming to the cancellous or spongy bone, right? Bone is a meshwork of bony spicule. Spongy मतलब sponge जैसा होगा, ठीक है. And trabeculae रहेगा उसमें, जो interconnecting rods and plates of bone से बना होगा, ठीक है. These are the large spaces filled with bone marrow. इसमें भी bone marrow रहेगा cancellous bone में, लेकिन in a woven form, right? Next is these lamellas आर सुपर इम्पोज, एक के ऊपर एक रहेगा, सुपर इम्पोज रहेगा, ठीक है। नाउ दिस इज ए differentiation between the compact bone and the spongy bone. Density dense रहेगा like ivory, and in spongy bone we have porous like a sponge. Haversian system रहेगा compact में present and spongy bone में absent रहेगा. Arrangement of bony lamella is regular and here it is irregular. Next is location in the bone. Location कहाँ रहेगा? Outer region, बाहर के तरफ रहेगा, क्योंकि ये हार्ड रहता है, आइवरी लाइक रहता है, तो बाहर की तरफ रहेगा। और स्पॉन्जी बोन इनर साइड में रहेगा, ठीक है। दैट इज यूजुअली कवर्ड बाय थिक बोन और कॉम्पैक्ट बोन, राइट। नाउ अमाउंट ऑफ bone marrow is absent in compact bone, and in spongy bone it is present. The amount of body by weight, it is 75%, and spongy bone is 25% of the body weight. Now coming to microscopically woven bone are young bone, and these are randomly placed, and lamella are mineralized matrix arranged in layers, ठीक है। These are the microscopical characteristics of the spongy bone. Now next we come to the last classification, that is the developmental classification. We have membranous bones, we have cartilaginous bones, and we have membranocartilaginous bones, ठीक है। This is a differentiation between the type of bones and giving their examples. Membranous bones of cranial vault, facial bones. Cartilaginous, we have bones of the limb, bones of the base of the skull, bones of the vertebral column, bones of the thoracic cage, and membranocartilaginous is mandible, clavicle, occipital bone, temporal bone, and sphenoid bone. See, membranous मतलब membrane से बन रहा है, ठीक है। cartilaginous मतलब through cartilage बन रहा है, और membranocartilaginous means both of them are involved, right? Now coming to the gross structure of a typical long bone, very easy. We have shaft, that is also known as bone, and we have two ends, ठीक है। Now the shaft is having compact bone, a cortex, and a medullary cavity. The medullary cavity has bone marrow which has yellow mostly, and yellow bone marrow which is mostly present, and red bone marrow during birth, because here in the red bone marrow there are most production of red blood cell going on, or other type of blood components also developing. Next is two ends. We have cancellous bone, that is spongy bone with articular surface, right? Now what is periosteum and endosteum of bone? Periosteum is periphery, so outer thick fibrous covering, and endosteum means inner thin fibrous membrane, right? This contains, both of them contains osteoprogenitor cells, that is stem cells, both osteoblasts and osteoclasts. What does osteoblasts do? They form new cells, right? And what are osteoclasts? They are macrophages type monocyte cells that break down the cells. So in this diagram you can see the two ends, there are spongy bone present with articular cartilage, and outside we have compact bone, right? And here we have periosteum, and inside we have the endosteum, right? Now the periosteum are all except at the areas of the covering by the articular cartilage. This articular cartilage, below this there is no periosteum, right? And endosteum lines the medullary cavity. This is the medullary cavity, and it lines this area. Now the periosteum has articular cartilage, and it is divided into outer dense fibrous layer and inner cellular layer, ठीक है। and it is attached to bone by the Sharpey's fiber. Sharpey's fiber means these are spikes of bones, and they bolt the periosteum to the bone. Here in the earlier diagram you could see Sharpey's fiber very easily. Here in this diagram you can see Sharpey's fiber like spikes in shoes. Now, functions. It maintains the shape. It gives nourishment. It provides attachment, and it has regenerative capacity. Very easy, right? Now देखते हैं कि what is bone marrow. Bone marrow is, we have red bone marrow and yellow bone marrow. Red bone marrow, as the name suggests, is vascular. Network of reticular fibers are present. Bone forming cells, all stages of development can be seen, and at birth present at all bones. It is a site of hemopoiesis. Hemopoiesis means production of blood cells, right? Now what is red? What is yellow? Yellow is formed by adipose tissue. Few hemopoietic elements are found, and in condition like severe bleeding, hypoxia, it converts into red. ठीक है. Clinically, bone marrow aspiration is done, performed by clinicians for diagnosis and therapeutic purposes, and the sites of bone marrow aspiration is sternum, hip bone and tibia. ठीक है. Now, parts of growing bone. Parts of growing bone में क्या है? The typical bone develops from a preformed model of hyaline cartilage. एक प्रीफॉर्म मॉडल रहेगा, पहले से बना हुआ रहेगा, एक कार्टिलेज का मॉडल रहेगा लॉन्ग बोन का, उसी से फॉर्म करता है. इट हैज़ टू एंड्स एंड शाफ्ट बिफोर ऑसिफिकेशन. ऑसिफिकेशन मीन्स जो कार्टिलेज है वो बोन में ट्रांसफॉर्म हो रहा है. ठीक है, उसको ऑसिफिकेशन कहते हैं. बिफोर ऑसिफिकेशन इट हैज़ एपिफाइसिस, एपिफाइसियल प्लेट, मेटाफाइसिस एंड डायाफाइसिस. राइट, एपिफाइसिस, एपिफाइसियल प्लेट, डायाफाइसिस एंड मेटाफाइसिस. दिस इज द एपिफाइसिस, this is the epiphyseal plate, this is the metaphysis, epiphyseal plate, and this is the epiphysis. Right, now coming to epiphysis. Epiphysis is of 4 types. This is very important for your exam purpose. Type of epiphysis. ठीक है, type of epiphysis we have pressure epiphysis, traction epiphysis, atavistic epiphysis, aberrant epiphysis. Now coming to pressure epiphysis. Pressure epiphysis is covered by articular cartilage, and it gives transmission of weight. Example, head of femur, humerus and lower end of radius. Traction epiphysis. What is traction epiphysis? Traction मतलब पुलिंग. सो कहाँ पर रहेगा? जहाँ पे पुल ऑफ मसल रहेगा, नॉन आर्टिकुलर है, और इट ऑसिफाइज लेटर इन लाइफ. ओके, नाउ व्हाट इज एटावेस्टिक एपिफाइसिस? दिस गेट्स फ्यूज टू द नियरेस्ट बोन टू रिसीव न्यूट्रिशन. एग्जाम्पल, ये पहले से मेन बोन का पार्ट नहीं है, पास में था, वो आके जुड़ गया, तो उसको एटावेस्टिक कहते हैं. जैसे कि कोराकोइड प्रोसेस ऑफ स्कैपुला, हमारे स्कैपुला में इधर, ठीक है, स्कैपुला में एक बोन है, पार्ट ऑफ द बोन है जो उसको कोराकोइड प्रोसेस कहते हैं. दैट इज नोन एज द एटावेस्टिक एपिफाइसिस, एंड अनदर इज पोस्टीरियर ट्यूबरकुल ऑफ द टेलस. लास्टली वी हैव एबेरेंट एपिफाइसिस. इट appears at unusual end of the long short bone, जैसे कि head of the first metacarpal. So these are the 4 type of epiphysis. Now what is epiphyseal plate? Epiphyseal plate is also known as growth plate. It is a part or it is a plate of hyaline cartilage between the epiphysis and the diaphysis. After fusion the bone cannot grow. मतलब epiphyseal plate अब अगर ossify हो गया, that means the bone will not grow. That means at a certain point of time in our life our growth stops. That means we don't grow by lengthwise, we grow by our breadth, right? So this plate, if in any x-ray, if this plate is present, that means the bone is still growing. So there are different stages of life where after puberty where bones get ossified and this epiphyseal plate gets disappeared. Okay, so what is metaphysis? Metaphysis is the area towards the epiphyseal growth plate. It is the most active growing area of the long bone and it has rich blood supply. ठीक है, it has end arteries taking bend hairpin. So जो arteries हैं वो इसी एरिया में बेंड हो जाते हैं. ठीक है, so now here we have osteomyelitis, that is infection of bone is common in children because they are growing ends, okay, and in metaphysis it is area towards the epiphyseal plate, okay. So क्या होता है, जो osteomyelitis है वो easily form कर जाता है in children में, right. Now diaphysis, it is the elongated part of the bone between the metaphysis. This is the diaphysis, that is the elongated part, okay. This is the metaphysis, this is the epiphyseal plate, and this is the epiphysis. So next is blood supply of bones. Blood supply of bones is done by nutrient artery, that is the main artery, periosteal artery, metaphyseal artery, and epiphyseal artery. These are named according to the areas they are supplied, ठीक है. जहाँ जहाँ पे बोन्स का जो पार्ट है उस एरिया में पर्टिकुलर आर्टरी है. नेक्स्ट वी सी दैट जो न्यूट्रिएंट आर्टरी है वो कहाँ पे है. न्यूट्रिएंट आर्टरी इज इन द मिडल ऑफ द शाफ्ट. इट रन्स ऑब्लिकली, divides into ascending and descending artery. Parallel branches enter metaphysis. They do hairpin loops and anastomosis with other arteries. इस डायग्राम में हम लोग देखेंगे, देखो न्यूट्रिएंट आर्टरी, ठीक है. It enters in the middle of the shaft, see, then it divides into ascending and descending arteries. It runs obliquely, see, it runs obliquely. Next, parallel branches enter metaphysis with hairpin loops, ठीक है, and it anastomoses with other arteries, right. Next is periosteal artery. These are numerous, enters through the Waxman canal, right. See, these are the periosteal artery, Waxman canal के through enter करेगा. And next is metaphyseal artery. Metaphyseal artery through the metaphysis. These are juxta epiphyseal, means juxta epiphyseal means epiphyseal के just पास में, ठीक है. Next, from neighboring it's formed by the neighboring arteries. Is it enters metaphysis by joint attachments, ठीक है, right. Next is epiphyseal artery. Epiphyseal artery anastomosis around the joint, ठीक है, around the joint, जहाँ पे ये joint form करेगा बोन के साथ उसके आसपास, ठीक है. It enters either directly or after piercing the epiphyseal cartilage. Either directly अंदर epiphysis में जाएगा या फिर epiphyseal cartilage के थ्रू ऊपर आएगा, right. Now blood supply of the short bone is same, except nutrient artery enters the middle of the shaft and immediately divides into plexus. It doesn't divide into ascending and descending, it divides into plexus, right. Next is periosteal replaces nutrient in adults, ठीक है. मतलब जो periosteal artery है वही arteries nutrient arteries में replace हो जाएगा in adults, ठीक है. Now what is fracture of bones, right. Next topic is what is fracture of bones. Fracture of bones is simply means break in continuity of the bone. It can be simple and can be closed, ठीक है, and it can be compound fracture, ठीक है. Next is, इतना जानने से होगा आपको फ्रैक्चर के बारे में, आप बाद में बोन्स जब और डिटेल में पढ़ेंगे तब आपको और पता चल जाएगा, ठीक है. Now how the bone is or how the fracture is repaired. Now first, जब bone break हुआ तब यहाँ पे हेमाटोमा फॉर्म होगा. हेमाटोमा मीन्स accumulation of blood, ठीक है, blood accumulation, ठीक है. This is known as formation of hematoma, ठीक है. यहाँ पे दिख रहा है आपको कि यहाँ पे जो पेरियोस्टियम है वो रप्चर हो गया ऐसी, ठीक है, एंड हेमाटोमा इन बिटवीन द बोन फॉर्म हो गया, पीसेस ऑफ बोन. दिस इज द मेडुलरी कैविटी, दिस इज द एंडोस्टियम, ठीक है. दिस पार्ट इज अ कॉम्पैक्ट बोन. नेक्स्ट इज फॉर्मेशन ऑफ फाइब्रोकार्टिलेजिनस कैलस, ठीक है. यहाँ पे जहाँ पे हम लोग का हेमाटोमा फॉर्म हुआ था उस एरिया में हम लोग को फाइब्रोकार्टिलेज फॉर्म होगा और न्यू ब्लड वेसल्स फॉर्म होगा. क्यों? क्योंकि वहाँ पे नया बोन फॉर्म हो रहा है तो न्यू ब्लड वेसल्स फॉर्म होगा और यहाँ पे एक हाइलिन कार्टिलेज बनना शुरू होगा, ठीक है. नाउ फॉर्मेशन ऑफ बोनी कैलस, दो तरह का कैलस फॉर्म होगा। फर्स्ट स्टेज में फाइब्रो कार्टिलेज, नेक्स्ट में बोनी कैलस। दिस बोनी कैलस विल फॉर्म न्यूली फॉर्म्ड सेकेंडरी बोन। सी बोन फॉर्म हो रहा है ना, यहाँ पे बोन फॉर्म हो रहा है, ठीक है। और यहाँ पे बोनी कैलस बन रहा है। आफ्टरवर्ड्स इट विल बिकम न्यू बोन, ठीक है। नेक्स्ट हील्ड, नेक्स्ट इज हील फ्रैक्चर, ठीक है। फ्रैक्चर हील हो चुका है और यहाँ पे दिख रहा होगा उबड़ खाबड़ हो गया है, यहाँ पे अनइवन हो गया है, ठीक है। तो ये कब कैसे ठीक होगा? रीमॉडलिंग से। रीमॉडलिंग से ठीक होगा। रीमॉडलिंग कौन करेगा? ऑस्टियोक्लास्ट करेगा, ठीक है। डन। नाउ कमिंग टू डेवलपमेंट ऑफ लॉन्ग बोन्स। टू टाइप्स ऑफ डेवलपमेंट इज देयर, इंट्रामेम्ब्रेनस एंड इंट्रा कार्टिलेजिनस। पहले भी बताया था। इंट्रा कार्टिलेजिनस मीन एंड्रोकॉन्ड्रियल, ठीक है। कुछ स्टेप है। फर्स्ट स्टेप में क्या होगा? मेसेनकाइमल सेल्स फ्रॉम द मेसेनकाइमल सेल्स फॉर्म मेम्ब्रेनस शीट मॉडल, ठीक है। वहाँ पे क्या होगा? ऑस्टियोप्रोजेनेटर सेल्स मिलेगा जो कि है ऑस्टियोब्लास्ट, ठीक है, फॉर्म होगा। These sites where osteoblasts appear is called ossification centers, right? Step 2. Osteoblasts secrete organic substances, that is ground substance and collagen fibers, in the intracartilaginous space to form osteotissue or bone matrix, right? Now next step is step 3 is under the influence of alkaline phosphatase secreted by the osteoblast, osteotissue is mineralized with calcium salts to become bone osteoblast. Trapped in mineralized matrix are called osteocytes. These osteoblasts, when they get trapped in mineralized matrix, these form the osteocytes, ठीक है। This is a step you can see. These are the 4 steps. Number 1, the mesenchymal model, the formation of the osteoblast, formation of the osteotissue and mineralization of the osteotissue, ठीक है। यहाँ पे क्लिनिकल है क्लीडोक्रेनियल डिस्टोशिया। इसमें 2 पार्ट है। क्लीडो मीन्स complete or partial absence of the clavicle bone and defective development of the cranial vault, right? Now what is intramembranous ossification? What is intracartilaginous ossification? Intracartilaginous ossification में पहला है cartilaginous cells under the influence of alkaline phosphatase gets calcified and the cartilage cells die and leave behind spaces called the primary areola, right? So these primary areolas are formed. Now cells on the surface of the periosteum differentiate into osteoblasts, enters the site of ossification along with blood vessels, right? Now most of the calcified matrix is absorbed, forming large spaces called secondary areolas and leaving behind these thin bars of calcified matrix, ठीक है। New bone, that is osteoid, is laid down on the surface of the calcified mass of the matrix, ठीक है। Next is mineralization of the osteoid, ठीक है। See, these are the step diagrammatic representation of the same thing that I told you, right? Formation of the primary and the formation of the secondary areolas and the formation of the osteoid tissue, right? And mineralization later, right? Next is ossification of long bone. Ossification, what does it mean? Ossification means the formation of permanent bone tissue, right? Now first step is hyaline cartilage model is laid down, like hyaline cartilage, a dummy model of, you can say dummy model or the outline of a bony model, okay. Now next, primary center of ossification appear at the center, likewise, ठीक है। Same time periosteum lays down collar of bone, that is periosteal collar, right? Secondary center of ossification develops at each end of the cartilaginous model and form epiphyses. Like if this is the model, here will be the first primary in the shaft and secondary will be at the ends. So from here it will start ossifying towards the epiphysis, right? Epiphyseal cartilage separating epiphysis from diaphysis and articular cartilage at each end of bone remains cartilaginous, ठीक है। that means if the epiphyseal plate, ठीक है, epiphyseal plate, this is the epiphyseal, remains cartilaginous, ठीक है. The epiphyseal plate forms new cartilage cells known as growth plate. This is the epiphyseal plate. It always form new cartilage cells that later on form the bone cells. In clinical we have achondroplasia, that is congenital disease, and it is also known as dwarfism, right? Now there is two things that I am leaving now, but I will include later, that is law of union of epiphysis and remodeling of bone, ठीक है. Now what are the ossification center? Sites where bone formation takes place is known as ossification center. These are two types, primary and secondary. Primary appears before birth, that is 7 to 12 week, and secondary after 12 week, that is birth to 5 years of age, ठीक है. Now there is a thing, primary centers appear after birth in tarsal and carpal bone except of talus and calcaneum, ठीक है, and cuboid. We'll know the things later. Just remember this when we will be completing our bones section. Then again, if you see this video, it will be very helpful and you'll understand a lot. Now there is a thing called law of union of epiphysis or law of ossification. In this law, epiphyseal centers which appear first unite last, and which appear later unites first, except fibula. Fibula is a bone in the lower limb, is the only long bone that violates the law, right? Then fibula, what it does is the epiphyseal center for lower and appear first and also unites first, and vice versa, ठीक है. तो fibula is the only bone in the body that defies the law of union of epiphysis, ठीक है, right, or law of ossification, ठीक है. Now growth of long bones. Growth of long bones is done by appositional growth and endochondral growth, ठीक है. Appositional means simply means addition, ठीक है. Now growth in periphery which result in increase in diameter. Growth in periphery which results in increase in diameter. So this is a bone in the cut section, and here it will increase like this. It will increase the diameter, right? Now osteoblasts in the surface of the bone proliferate, then superficial ones remain as such and divide again, right? Deep one produce bone matrix and become osteocytes, right? And layer of bone is deposited in the surface, right? And the diameter is increased. So this is known as appositional growth. Next, what is endochondral growth? Endochondral growth is increase in length. See, ठीक है, cells multiply in the epiphyseal plate that I have told you earlier. New cartilage formed which pushes the epiphysis away from the diaphysis, right? And they have zones of epiphyseal plate, right? Like first zone is zone of resting cartilage, zone of proliferation, zone of hypertrophy, and zone of calcification, ठीक है. These are the four part of the epiphyseal plate in which there is formation of new cartilage, there are some resting cartilage, then below that we have proliferation phase, then hypertrophy means increase in the size of the cells, and then calcification means formation of new bones, ठीक है. This is how the epiphyseal plate works. Now clinical, we have in epiphyseal plate which is responsible for growth. Once it stops, ठीक है, or it forms the diaphysis, the growth stops, right? So this was the class on skeleton. I hope you like it. Do subscribe my channel, and thank you for watching. and I would like you to comment down, and if you want any specific areas or any specific type of videos you want to know about any particular topic, you just comment down. और ज़रूर बताना कि मैं हिंदी में कंटिन्यू करूं या ओनली इंग्लिश में कंटिन्यू करूं, क्योंकि हिंदी में कंटिन्यू करने से बहुत लोगों को पता चलेगा, प्लस मेरा हिंदी में बोलने का जो प्रैक्टिस है वो भी हो जाएगा. ठीक है, थैंक यू सो मच एंड सी यू इन द नेक्स्ट वीडियो.